Hi, everyone. My name is John DeBello. I'm a first year medical student here with my friend Michael, who's also a first year student with me. And we're here to talk about back pain. I know that I've unfortunately suffered some injuries, and early in my life, my back has already been a kind of source of constant pain for me. So we're here to share some things that hopefully will be helpful and will definitely be available to follow up with all of you if you have any questions. So thanks for going on this little journey up and down the back with us.
All right, so to get started, we wanted to talk about the spine, which really includes your neck and your back. The cervical spine up here in purple, that's also known as the neck. And then the typical back pain that people think about tends to occur in the lumbar spine, in the orange there, and can kind of involve your pelvis or your hip bones as well. So it's estimated that 80% of Americans will experience low back pain, as I'm sure you guys have experienced, unfortunately. And in terms of all the pain that patients experience, 30% of that pain is described as low back pain, while 15% of the pain can be described as neck pain. So kind of getting into the anatomy of the spine without going in too much depth, we can see on this slide in the blue, you have the vertebra, which are the bones within the spine in white there. And then it looks like a light purple. Those are the discs within the spine. And those are almost like a shock absorber between the bones. And most of the back pain is caused by changes in these vertebrae. So in terms of risk factors on the left side of this slide, that includes age, lack of exercise. So fitness level is more common in people who are not physically fit. Back pain is. For example, weak back and stomach muscles may not properly support the spine, resulting in back pain. Another thing to keep in mind is excess weight puts more pressure on those vertebra and the spine bones, and can decrease that space between the discs that are the cushioning. And then other factors include job-related risk factors, improper lifting, poor posture, and smoking as well. So in terms of describing back pain, it can be described in many ways. Kind of mechanical pain or pain in one area is described as axial pain. Then we also have referred pain, which is more of a dull, constant, achy pain. And that can move around your back in various intensities and locations. And then another pain that patients typically experience is sciatica or radicular pain. And that's that feeling of the electricity shooting down your legs, kind of leaving your back and going down your legs. And radicular pain can be accompanied with numbness or tingling down your legs as well.
So knowing that most of us will experience some sort of back pain throughout our lives, it's good to get ahead of it, or even if you are experiencing some, to kind of have strategies to deal with it. So we're going to talk through some of those now. Any sort of exercise where you're focused on your core muscles, both kind of in the front and the back core muscles, so kind of in your abdomen area. And for demonstration, those are going to be really good exercises to kind of strengthen the muscles that support your back and your posture. Even I could work on my posture right now. So exercises like Tai Chi, yoga, anything that's weight bearing, that challenges you to balance better. Those are going to decrease back pain, but also decrease your risk of falling or injuring your back during various exercises or while carrying groceries or something like that. Also, eating a healthy diet allows your body to have all the nutrients that it needs to stay strong, both in your muscles and in your bones. That includes calcium, vitamin D, as well as like protein and stuff like that. We sort of mentioned earlier how maintaining a healthier weight is one way to reduce the stress that you're putting on your body. Obviously, that comes with all of its difficulties, but definitely is helpful towards back pain. Like I said, a little bit earlier, having a better posture, especially while you're like sitting for a long period of time, maybe while watching TV or reading a book or doing work, making sure to avoid slouching and have a supportive stance. And also just making sure that if there's a heavy item that you're lifting it with someone, or that you do so with proper form, you stay within your limits, just to avoid pulling anything that could lead to something that's really challenging for you. There are a lot of ways to take care of back pain just within your home without a doctor or any sort of professional help. That includes taking something like an ibuprofen or like Advil, Tylenol, anything that's going to bring down that inflammation and relieve some pain in the short term. And that can be a great solution if you do experience some sort of back injury acutely, like it has just happened. Something else when you're recovering from some sort of initial injury that's helpful can be using heat, some sort of hot pack that will actually increase blood flow to that area and allow for more healing. And usually about after 6 weeks, if some sort of back pain is, or any sort of pain related to your muscles and joints is persisting, we would consider that moving into the chronic phase of pain. And in that case, the hot packs are going to be less effective, and something more akin to a cold pack, so ice or even just a bag of peas from your freezer, can be super helpful in order to reduce the inflammation, reduce the blood flow to that area, kind of trick your body out of thinking that it needs to be in pain anymore. Definitely something for me that I've realized is that kind of staying active and avoiding bed rest could be helpful for back pain. And then also, if you notice any specific movements that really bring about a lot more pain, just trying to avoid those. And if it does get to the point where you may feel like, I'm trying to take care of myself with this pain, but it hasn't been effective enough. Like my back pain's getting in the way of my day-to-day activities, the things that I really want to be doing. That's probably a good time to reach out to a healthcare professional that's really trained to take care of you. So some different people that you may contact are physicians that deal with pain in terms of medication, or orthopedic surgeons, and even neurosurgeons, because sometimes pain can be associated with our nervous system and not just with our muscles and bones. And from there, they might connect you with a physical therapist who could help you learn different exercises. And I've even gone to a chiropractor in the past who has different sorts of mechanisms to try to help align and heal your back and body. And then also athletic trainers are a part of, often athletes training, because they are helpful with athletic injuries.
So now that we've mentioned the typical providers in treating back pain, we wanted to dive into each provider and what a typical visit might look like in terms of their services. So the first three here, the top of the list, are more conservative treatments. And then if it gets more severe, you would go to maybe a pain doctor or a surgeon to address the problem. So physical therapists tend to teach you stretching and strengthening exercises for your back, including electrical stimulation, traction, or applying those heat or cold packs to really either get the blood flowing or prevent blood flow, depending on your situation. There's also chiropractors, as John mentioned, and that, again, typically involves some sort of manipulation of the spine to improve your range of motion and hopefully target the source of pain. Another provider for back pain can be athletic trainers, and these are more looking towards preventative measures, including teaching you proper posture, potentially giving you a back brace, or teaching you exercises to strengthen your core and alleviate some of the pain and stress that's put on your back. And then the last two options here are more kind of the second resort if these more conservative treatments aren't working, and that includes pain doctors who would potentially prescribe some sort of oral medication or potentially an injection to relieve the back pain, as well as surgeons, including orthopedic surgeons or neurosurgeons, who can provide surgery if it's needed, but also conservative treatment. I think there's this thought that if you go to a surgeon, you're absolutely going to get surgery, but they're looking out for what's best for you and ideally only doing surgery as a last resort. So if you think your back pain has gotten to a point where you need to prepare for an appointment, this is what an appointment might look like. Your doctor will ask you questions about your medical and family history, and they're just doing this to help determine if an injury or underlying medical condition is the source of the pain for your back pain. Some other questions that the doctor might ask could be, can you describe your pain? So here you would say, oh, it's really sharp, or it's more of this achy burning feeling, and you would describe it. They would ask you where the location of your back pain is. Is it in the lower back? Is it kind of more in the thoracic spine, which is more of this mid spine area, or is it more neck pain? They also might ask what you were doing when you first noticed the pain. Was it a sudden onset? Were you lifting something really heavy? Or did it come on gradually? As well as the severity of the pain and what factors make it better and what make it worse. So we wanted to finish up including some exercises that can help strengthen your back. I think it's important to mention that these exercises should only be done if you don't have back pain and to hopefully prevent back pain. But if your back is hurting, you really don't want to do these exercises as they could alleviate, or I'm sorry, as they could worsen the pain. So most of these exercises are based around getting blood flow to your spine. In cases when you don't have back pain, it's really important to get the blood flow there because it has a lot of nutrients to nourish the area, like the bones, the vertebra that we mentioned, as well as the discs. So in the middle here, this can be as simple as sitting at your chair and doing some arm motions to really move the spine around and get the blood flow there to prevent back pain or injury. And then on the right, you can see some yoga postures if that is more your speed. So that's our presentation. Thank you so much for tuning in. If you have any questions, please reach out and we'd be happy to answer them for you. Yeah, thank you.
Thank you. Bye-bye.